Well, good afternoon, and thank you so very, very much for joining me in this presentation that I've entitled, Take Control of Your Blood Pressure. I'll tell you what, there's no more appropriate time than now with all of the foolishness, with all of the pandemonium, with all of the stuff that's going on right now in our society. It's not hard to get your blood pressure rising a little bit here. So I think this is very, very appropriate. So what we're going to want to do is to take control of our blood pressure then. Right. So with that being said, then we're going to move on. And as I thank you, I appreciate you joining me here today, taking time out of I'm sure a somewhat a busy schedule to join me in this presentation. And hopefully the information that I'm about to share with you is going to be of tremendous benefit to you. So again, for those of you who don't know who I am, my name is Dr. Robert Bartosh, a Proactive Wellness and Injury Center, and our purpose, our goal in our center is to help anybody and everybody who comes to us wanting so, helping them to achieve the best performance of their life. And I found that the more educated an individual is, the better equipped he or she is in taking the responsibility that is theirs in regards to their health. So again, thank you very much for joining me, and we'll move on now. And as I do, I'm going to go ahead and get deeper into this. As we talk about the blood pressure now, I need to explain exactly what the blood pressure is. So let's look at that here. The blood pressure is, it's actually the force that's needed to push blood through your arteries coming from your heart to deliver oxygen-rich blood to your body. Now, the first place it's going to go is to the brain, because the brain happens to be the single most important organ in the body, and it has to be fed first, if you will, in order to maintain its function, so that all of the other organs and systems, everything beneath it that's dependent upon it, will operate properly. Now, when your blood pressure is measured, what you're going to do is to get a high value. That's called the upper number. That's your systolic pressure. And then there's a number beneath it. That's the low value. That's the diastolic pressure. Now, the high number is the highest pressure that occurs in your blood vessels when your heart is contracting. That's the highest amount of pressure through all of the circulatory system. That happens exactly when your heart squeezes and pushes that blood out of it. And the low value, that's the pressure in your arteries between heartbeats when your heart is relaxed. So as the heart is refilling and it's relaxed, that's the measurement of the pressure there in your arteries. Now, blood pressure reading of 120 over 80, I'm sure most of you are aware, that's considered healthy. That's the norm that we go by. And high blood pressure, which is also known as hypertension, is typically considered anything over 140 over 90. So again, the normal blood pressure is recognized as 120. That's the systolic number, the high number, over the low number, over 80. So 120 over 80, and the 80 is the diastolic. And if you have blood pressure that has been measured 140 over 90, then you're going to be diagnosed with having hypertension. And even though that has been the norm for many, many years now, my understanding is that the American Heart Association is now stating that 130 over 80 is the diagnosis number for hypertension. How they come about that, I have no idea, but that's what they're stating is the new norm. So having an elevation in just one of those two values may be enough for a hypertension diagnosis. And by that I mean the top number, if it's higher than 120, it could be possible that your doctor will diagnose you as having high blood pressure. Or if you're 120 over 90, that's a higher number than the 80, which is typical. That doctor may also diagnose you as having high blood pressure. Okay, so now as we move on with this, what exactly is high blood pressure now that you know the numbers, because what we want to do is to give you an understanding about this here. So when the pressure required to circulate your blood is high, when when that number gets higher, it's going to place an abnormal amount of stress on your heart muscle, and also on the smaller arteries, because there's an increased pressure now going through them, and it's going to reduce the amount of oxygen that's delivered to the very small vessels in the body. That's what's going to happen. You're going to have a reduction. You're going to have an increase in pressure in the circulatory system, and you're going to have a reduction of the oxygen that's available to the body. Now, both of these consequences account for many of the secondary effects of hypertension. See, unfortunately, most people are just focused on the numbers there of high blood pressure, and they don't realize. Many of them don't realize that there are other things that are going on that they kind of discount as being related to high blood pressure. But people with high blood pressure can experience recurring coughs, see, and they dismiss it as something that's separate. Or believe it or not, these people can have diarrhea or constipation that occurs or recurs on an ongoing basis. Individuals can experience dizziness and lightheadedness, which most, I'm sure, are aware of. They can have problems of feeling very nervous or jittery, or a feeling of being exhausted or tired, weak, drowsy. You know, you just have that lack of energy feeling, or headaches as well, and nausea and vomiting. Now, some of those I'm sure some are familiar with as far as effects or symptoms, but there are others that, as I mentioned there, that people aren't even aware of. So now what we want to do is, as I mentioned those things, I want to share with you some common causes. What causes high blood pressure? Because that, you know, if you know what the cause is, many times it will present to you the solution or the answer to it, the resolve of it. You can get rid of it. But according to the medical physiology textbooks, what they say is that as much as 95%, that is 9.5 out of 10 people that have hypertension, um, it's the underlying cause is unknown. And I really don't understand that, and nor do I agree with it. You see, you simply, that can't be true. There are a number of factors that have been identified as contributing to high blood pressure, but you know, people just, they don't try to find out what's causing it. When you go into your doctor, he or she will just give you the diagnosis and then immediately put you on some type of high blood pressure medication. Now, look, you have to understand that when you're on the meds, your problem hasn't been taken care of. I mean, the problem is still there. What's causing the high blood pressure is still there. All you're doing by taking the medication is putting a lid on it, if you will. You are chemically restraining the heart so that the pressure doesn't increase. So it would be like having a fire that's burning, and instead of putting the fire out, you're bothered by the smoke that it's creating, so you put a fan up to blow the smoke away from you instead of putting the fire out. That might be an overly simplistic example, but nonetheless, I think you understand that. Now, also, I want you to know that there are two hormones that could be the cause of having high blood pressure, one of which is insulin, and the other is called leptin. And you can have an insulin and leptin resistance. Now, this could be the core of the problem for most, but certainly not all people with hypertension. But I would say that there's a lot of people that have high blood pressure that their problem is a resistance of the body to insulin and also another hormone called leptin. And so it would be really, really important to make sure that if you have high blood pressure and you're on the meds, that you're burning fat as your primary fuel. See, the body will either burn sugar or it'll burn fat. And if you get that diagnosis, then you want to start manipulating your diet, the foods that you're eating, so that you start to burn much more fatty foods as fuel than you would sugary foods or carbohydrates. Now, the insulin, the hormone there, what that does, it helps your body to store magnesium. That's one of its benefits. Listen, it helps the body to store magnesium, which is going to help to relax your muscles. Now, if your cells have grown resistant to the insulin, then your body's not going to be able to store the magnesium, which is going to lead to the blood vessels becoming constricted. They're going to become smaller and smaller because, believe it or not, the diameter of your blood vessels of your circulatory system is going to be determined by the muscles pulling it or relaxing. And if the blood vessels are becoming more constricted, that's going to cause your blood pressure to rise. So as your insulin and your leptin levels rise, it's also going to cause your blood pressure to increase. And this could be the reason why every so often you've got to return to your doctor and get a new prescription for your blood pressure medication because it's no longer working and your blood pressure is rising. Now you need something stronger. Again, it could be due to the elevated rise or resistance of in your body to insulin and leptin. Now, also what happens is that there are what are called elevated uric acid levels. Those are significantly associated with hypertension as well. So any program that's adopted to address high blood pressure, it really needs to normalize your uric acid levels as well. And this is something that we do in our center when we have patients that are interested in getting off of their blood pressure medication, or I should say returning to the best performance of their life. This is one area that your doctors need to look at. It's your uric acid levels. And poor nutrition, we found, at least I found clinically in the childhood, and as we look back in the history of the individual, it's been shown to raise the risk of high blood pressure in adulthood as well. So that might be something that you might, look back in your childhood, and if you were eating poorly then, and you're continuing to do so now as an adult, that could be a very powerful contributing factor to you holding on to that problem of high blood pressure. Also, another player in this is, believe it or not, air and sound pollution. Now, air pollution affects blood pressure because it causes inflammation, that it causes the circulatory system to inflame, to swell. And as it swells on a cellular level, those vessels become narrower and narrower. The arteries do the same, and that increases the blood pressure. And noise pollution also has an effect via your nerve system, not only on muscle tension. You know how when you hear something irritating, or it's loud, or it's just, it causes your muscles to tighten up, and you just grit your teeth because it's so ingratiating, it's so irritating to you. Well, what happens is it can affect your nerve system, and that will affect your hormonal system, and it goes back to affecting the insulin and the leptin as well. So, living in an area that's plagued by constant noise pollution, busy city streets, in a bigger city, or if you live in an area where there's a lot of traffic day and night, the research shows that that actually increases the risk of the individual of having hypertension by at least 6%. Now, 6% may not seem like much in and of itself, but if you're living in that area day in, day out, and then you add to that, we'll say a stressful environment at work, we'll say a stressful environment at home with the family, you're eating poorly, perhaps you have other issues or other habits, I should say, that are going on that are contributing to that, and that can really have a tremendous effect on you, and one of which would be adverse as well. So to address those factors, if you want to take control of your life, if you're a smoker, you want to avoid smoking. If you live in an area that is noisy most of the time, you might consider even wearing earplugs to fall asleep, or when you're going to sleep, if you're living in a noisy neighborhood. And if you're in a polluted area, then you might even consider clearing out the air, because as I said, the air pollution is going to contribute to the effects of having high blood pressure as well, or causing it, I should say. So now that we have addressed some of the causes, we want to look at some of the effects that high blood pressure has on your body. Unfortunately, when we look at this, you know, there's over 20% of the people who suffer from high blood pressure. They're even unaware of the condition. They don't even know about it until they go to a doctor and have their blood pressure taken. And significantly, it increases the potential. When you have high blood pressure or have been diagnosed with it, it increases your potential risk of having a lot of other health problems as well. If your blood pressure is uncontrolled, or if it's poorly controlled, you increase the risk of very significant health effects that reduce your quality of life, and they have a very negative effect on the longevity of your lifespan, on the length of your lifespan. Hypertension or high blood pressure increases your risk of stroke, as it can cause the blood pressures in your brain the blood vessels, I should say, in your brain to rupture and even clog more easily. And in both of those instances, the oxygen supply to a portion of the brain, wherever those vessels are going, is going to cease. It's going to be reduced, and that's going to result in the stroke as well. And the increased workload on the heart because of that scenario may result in heart failure or having a heart attack, and also damage to the arteries that are supplying the heart muscle, and oxygen may result. The arteries that are supplying the blood and the oxygen to the heart may result in a heart attack as well. There's a lot of domino effects here that I think most people aren't even aware of or been made aware of by their treating physician. You know, the high blood pressure can damage smaller arteries, and it reduces the amount of oxygen that's delivered, and severely impacts the ability of other organs to function, such as the kidneys and the eyes, especially the kidneys and the eyes. We're seeing now a tremendous increase in dialysis centers. And if we look back in the history of these people now that are suffering with chronic kidney disease, chronic means it's been going on for quite a while, even before the person realized it, many of these people were having, they were diagnosed with having high blood pressure. And the high blood pressure over time got worse and did more and more damage. So now the person has been diagnosed with chronic kidney disease, and they have that type of a problem as well now that they're dealing with. And also the eyes, they're losing their vision, and they attribute that to some other condition. Those vessels in the eyes, they can be clogged, they can rupture, and if they do that, the oxygen isn't getting to the eyeballs, and those eyes literally start to die. So as I said, this can result in kidney failure. It can result in visual loss or blindness. And the damage to the smaller vessels, when we're talking about that, it's called microvascular disease. And that can lead to angina, you know, that diffuse pain over the chest, or the chest pain when the heart muscle doesn't get enough oxygen to it. That's what the angina is, as this gentleman here is portraying in this slide that I have in front of you. And then atherosclerosis, that's another form of damage to the arterial system that's can result from hypertension or high blood pressure. And that usually happens in the peripheral vascular system, and it causes or results in peripheral vascular disease. That's the peripheral vascular disease that's affecting the toes and the ankles and the legs and whatnot, those that are furthest away from the heart. And the narrowing of the arteries, it occurs in the legs, as I said. It can occur in the arms. It can affect or occur in the arteries going to the stomach, to the head, and that can trigger a lot of pain, a lot of fatigue, and a lot of serious damage after that occurs as well. So the question you need to ask yourself is, are you at risk? You know, in the United States, according to the CDC and the National Statistics, oh gee whiz, the name now, the database that we have on diseases in the United States, it's estimated that 1 in 3 individuals has high blood pressure, and 1 in 3 has what's called pre-high blood pressure or pre-hypertension. See, before you become a diabetic, you are in a state of pre-diabetes. You're developing, or eroding, I should say, into becoming a diabetic. Well, the same is true of having high blood pressure. You didn't go from 120 over 180 to 140 over 90 overnight. It just doesn't happen. So what's been happening is, because of circumstances, because of lifestyles, because of ignoring symptoms or signs that the body's been giving, because of poor choices we make, that blood pressure has been rising and rising and rising. So it goes from 120 to 128, then it goes to 132 to 138 to 140, whatever that might be. These things develop. So when you're going into your doctor, if he or she is checking your blood pressure and it's 128 over 84, that would be an indicator that perhaps something is in a developmental stage, and it would behoove you to go ahead and to monitor your blood pressure on a regular or daily basis, so that you can see, as you would a thermometer, if the temperature is rising or if those numbers are rising. Because if they are, then you know that your body is telling you that something is not right and you need to get it taken care of. Now, typically, your systolic or your upper number, that pressure offers the most information about how stiff your arteries are. And I know that most people don't realize that. But when that number on top is going up and going up, it's actually an indication that your arteries inside of your body are becoming rigid. They're becoming very, very stiff. And how much pressure is needed to push the blood around the body as well. That means that the heart is having to beat harder and harder every time, the higher that number is. Because when those arteries are stiff and rigid, it becomes more difficult to move the blood through it. And the elevated systolic pressure, that is a major risk factor for cardiovascular disease and stroke. When you see that number going up, that's a substantial alarm that's being sounded by your body. As a matter of fact, the recent research suggests that hypertension, especially the elevated systolic pressure, that number on top, that may also raise your risk for dementia. And my gosh, the research that I've seen is indicating that indeed. We're seeing that people, many that had type 2 diabetes, also with high blood pressure, people that had high blood pressure develop type 2 diabetes, whatever. But those types of people we're seeing now, those are the ones that have the highest potential of developing dementia. And we're seeing the people that have dementia, as we look back in their history, we're seeing that those individuals indeed had high blood pressure or type 2 diabetes, and or a combination of both. And then there are previous studies. They've already shown that stroke victims, even if it's a minor stroke, they are at an increased risk of having Alzheimer's. It's frightening information. And this adds further weight to recommendations to get the blood pressure under control. And once you've got it under control, you need to really work on getting rid of it totally and wholly. Can it be done? Absolutely, positively. It doesn't mean that you have it permanently. It just means you will, based upon decisions that you make. And if the doctor that you're going to isn't offering you a means or methods by which you can get rid of it, then you might consider finding another doctor, really, that will work with you. Because if you do stay on that, your risk of developing, as I said, cardiovascular events, dementia, Alzheimer's, strokes, and whatnot. And I did another program regarding strokes. And if you are an individual that has high blood pressure, it would serve you well if you were to watch that presentation, because once you've had one stroke, a minimal, even a minor stroke, it's like having an earth tremor before an earthquake. And you have those little transient ischemic attacks, those little mini strokes. That's your body is telling you that you're headed for the big one, for a major earthquake. And it could be, it would be life altering or life ending. So this is something where, you know, you want to follow up and get it checked out. Now, as we continue, high blood pressure, as I said, has been linked to the Alzheimer's risk. There was one study that found in the older adults having elevated average systolic blood pressure puts the person or puts the individual at a greater risk for brain lesions and tangles that are associated with Alzheimer's disease. The body has been fearfully and wonderfully made, and it's always speaking to us. It's letting us know when there's a problem that's developing. Unfortunately, most of us just ignore that and we brush it off, and we just keep on moving on, or we take some kind of an over-the-counter medication, or we see, I don't know, but you know, for the most part, we just don't respond to it in a proper way. And then it's like any other problem. If it's not taken care of properly, it gets bigger and bigger and worse and worse. And then the person ends up with having some other major issue, health challenge that they're dealing with, and not realizing that it was a fruit, if you will, that was an offshoot of what they ignored earlier on. So with that, I want to tell you, the average blood pressure of the seniors that were enrolled in this study that I alluded to, that showed that they were a greater risk for the brain lesions, the strokes and the lesions, the amyloids, and the tau protein and whatnot that's associated with Alzheimer's disease. Those people had an average blood pressure of 134/71. Now, remember, I told you that the top number is the more significant of the two, 134/71. And 87% of these elderly people were taking meds for high blood pressure. That's what this research showed, 87%. And the participants were followed until death, or for an average of 8 years. And the average age of death of these individuals was 89 years old. Now, the researchers found that the risk of the brain lesions was higher in people with higher average systolic blood pressure across the years. Those people that had that 134 or higher, they had the brain lesions. And for a person with one standard deviation above the systolic blood pressure, for example, 147/134, or 147 in comparison to 134 for the top number, there was a 46% increase risk in having one or more brain lesions. And specifically in this research, it was infarcts. It was the equivalent of 9 years of brain aging every time they had an infarct. Let me kind of break this down for you. Every time the top number increased, it caused more and more damage, and the damage that it caused in the brain became more and more significant. Now, these people, many of them lived until the average their age of death was 89. But, we might think, well, at least they lived a long life. But the point of this research was that though they lived a long life, they were debilitated. They had strokes, they suffered dementia, Alzheimer's, they had ischemic attacks in the brain, they were in assisted living facilities. The quality of life was subpar, to say the least. And what you've got to understand here is that these people thought they were doing well as well, but they weren't. See, so what I want to do is I want to educate you so that you can take responsibility for your health here, so you don't become, because if you look at the statistics now for dementia and Alzheimer's, it is increasing at a rapid rate. And you know, these people, it's the Alzheimer's in and of itself is not a disease, it's a condition that is a result of an eroding status of health in the individual. They have one thing that they ignore, it leads to another thing, it leads to another thing, another thing. Is like a domino effect until boom, they are now, you know, they started out with high blood pressure, then they got type 2 diabetes, or the type 2 diabetes first, and then they got the high blood pressure, and then they got depression, and then they got, you know, thyroid condition, and then they got the dementia or the cognitive inabilities. And this is the patterns that we are seeing now as these things are happening. It's not just something that comes out of the clear blue. It's been developing over years and years and years in people that thought they had a handle on it, when in fact all they were doing was graduating from one medication to another to treat one disorder to the next. So what I want to do is to educate you here as to what you can do. And I want to tell you here that your diet influences your blood pressure. One of the most important dietary changes that an individual who has high blood pressure, in order to improve it, needs to make is to eliminate or dramatically reduce the sugar, especially the processed fructose that's in the diet. If you pick up a label and it has high fructose corn syrup, or it has fructose, or it has corn syrup, or it has sugar, gosh, you need to put it down and find something else. You really, really do. And I'm not advocating you pick up a synthetic sweetener either. I'm telling you, you need to get that garbage. I'm suggesting to you that you need to get that junk out of your diet, because if you don't, it's not just about your weight. It's about what's going on inside of your body. There was one study that was done back in 2010, and I do a lot of reading when it comes to research and that. And in this study, they discovered that those who consumed just 74 grams or more a day, just 74 grams a day of fructose, that's the equivalent of about 2.5 sugary drinks, just two and a half cans of sugary drinks a day. They had a 77% greater risk of having high blood pressure levels of 160 over 100. You understand what that? This is just drinking 2.5 sodas a day. And you don't have to drink 2.5 sodas. What you do is you get the sugar or the fructose or something else in your diet, in some other food. And consuming that 74 grams or more of that a day also increased the risk of a 135 over 85 blood pressure reading by 26%, and a reading of 140 over 90 by 30%. Just by doing that increases your potential of having severe high blood pressure. Now, there was another dietary culprit, and that one is trans fats. The trans fats, you got, and that's responsible for the atherosclerosis. Remember, the hardening or the stiffening of the arteries. So if your diet, if you're consuming trans fats on a regular basis, that's what's going on inside of your body, unbeknownst to you. Just because you can't see it on the outside doesn't mean it's not happening on the inside. And that's another trigger for hypertension. So you got to avoid the trans fats, the hydrogenated fats like the margarines, that's garbage. The vegetable cooking oils, it's garbage. The butter, I can't believe it's not butter spreads. Get rid of them. They're garbage. And also the baked goods, the stuff that you buy from the store that's baked, the baked pastries and goodies. Stop eating them. If you look at the labels, those are the very things that are filled with the fructose, the high fructose corn syrup. They're filled with the trans fats. They're filled with the hydrogenated oils. Get it out of your diet. Now, the easiest way to cut both the sugar and the unhealthy fats from your diet is to replace the processed foods with real whole foods. That's what you've got to do. That's going to address not only the insulin and the leptin resistance, see, because that's basically how your body has become resistant to both the insulin and the leptin. That's also elevated your uric acid levels. This is one of the first things that we do for our patients in our center is we look at what they've been eating, because they are the creator of their situation by and large. It's your environment, the things you eat, the activities you do, the things that you smell, the things you put on your skin, the things that you drink, the things you surround yourself with. We're creatures of habit. We do this day in and day out and day in and day out. And you know, you can go to a doctor and get the pill to suppress the blood pressure. But if that's the only thing that you've done and you haven't changed the food, the activity, and you haven't changed your environment, you haven't done yourself justice. You are literally headed down a very slippery slope. You really are. And the insulin and the leptin resistance is just going to increase, and the uric acid in the body is going to increase, and you're a statistic that's just about to happen. That's all. Now the type of fat you need more of is the animal-based, like the omega-3 fats. And again, the research has shown that those with the highest serum levels of omega-3 fats, they have the lowest blood pressure readings. I find that my patients, and we look at them, and the research validates it as well, when their diet changes and they have the omega-3 fatty acids in their body rather than the trans fats, the omega-6s in their bodies, they have lowered their blood pressure. If they did have high blood pressure, it starts to lower. On the average, their systolic pressure starts to drop by 4 millimeters each day. I mean, just drops and drops and drops and drops as they continue to do that, as they change their diet and they change their lifestyles. So it's recommended that you get your omega-3 index tested at least once a year. If you have high blood pressure, this is what we do. This is what we recommend. You get those fatty acids tested, the omega-3s and the omega-6s, the ratios, you get them tested at least once a year, see? And by doing that, you're going to see that the steps that you've taken are paying off, and that your blood pressure is staying lower, that you're doing the right thing. And the best way to boost your omega-3s is to eat, you know, certain types of fish. The fish that are going to be low in mercury and other pollutants. You want to be careful of that as well. And good options would be like the wild-caught Alaskan salmon, sardines, anchovies, mackerel. Those are the ones that you're wanting to be eating, not the cod and the tilapia and the lobster and the, oh gosh, I don't know what else people are eating, but there are certain fish that you're going to want to eat that have the omega-3s, and those are the ones that you're going to want to be eating. And if you're not eating them, then you need to get on a purified, high-potent omega-3 fatty acid. And if your doctor that you see doesn't have that available, you're welcome to contact us. This is what we do. All right. Another thing you can do, the beets. Yeah, eating the beets. I know there's a big kick now of selling the beet powder. You don't have to eat the beet powder. The better way to do it is to eat beets. It's one of the most important dietary changes. That can improve high blood pressure, bring it down, to eliminate and dramatically reduce the sugars You want to reduce those fructoses, as I said, and what you want to do is to go ahead and start to eat some beets, to get some beets in your diet. You know, as yucky as it might sound to you, start eating some beets. And look, if it's too much of a problem, if your palate can't stand the beets, then find a um, a reputable pharmaceutical grade beet formula, okay? Because that's going to help to lower your blood pressure. Now, look, as we get into this, I don't want you to think that just by doing one thing, it's going to be the answer. That would be like saying, well, all you need are 2 eggs and you can make a loaf of bread. You can't do that. You have to have other ingredients to make the end product. To do these things, you're going to have to add a multitude of different things to your diet, or change a multitude of different things in your diet in order to get the desired results. So one of the things, of course, I said was to cut out the sugars. The other was the trans fatty acids. The others was to increase the omega-3 fatty acids. The others might be to increase the amount of beets, or introduce beets into your diet as well. Another thing to do is to boost your nitric oxide levels. Yeah, high intensity exercise is going to help to increase the nitric oxide production in your body. And ideally, when you're eating nitrate-rich vegetables and you're doing exercise, that's going to help out tremendously. You get that in the dark green leafy vegetables. They're sprouted veggies as well. By doing that, you'll provide the raw materials for the body to produce nitric oxide. Nitric oxide is vitally important to the health of your heart, which is going to be controlling the blood pressure. And goodness gracious, if you have high blood pressure, you got to know that it's putting a never-ending stress on your heart. And if that blood pressure isn't controlled and reduced, then you are you're in line for having a cardiovascular event, like a heart attack. So the nitric oxide is very, very important. It's something that you want to introduce into your diet, and you want to introduce into your lifestyle through exercise as well. Also, potassium levels, those impact the blood pressure. It's a naturally, potassium is naturally occurring mineral that your body uses as an electrolyte, and it's really vital for all of the body to function normally. If you're experiencing diarrhea, remember I said it can be one of the symptoms of high blood pressure that you have on a recurring basis, or the constipation, or the vomiting, or excessive sweating, like like when you're in a sauna, or you're sleeping at night and you wake up drenched. And if you're on other medications, they're going to deplete, or they're going to disrupt your potassium balance in your body. All of those things are going to remove a lot of potassium from your body. But the most important reason your potassium levels are not within normal limits is that it's probably due to poor dietary choices. The average reported intake of potassium from food is about half. And the RDA, the recommended daily allowance, it's archaic at best. But they would say that you need over 4,700 milligrams a day. Boy, this has a significant impact on your blood pressure, especially as it relates to the amount of the salt that's found in the foods that these people are probably eating as well. If they're eating the standard American diet, they're not only not getting the potassium, but now they're loading up with the sodium. I mean, this just goes on and on and on, the nitrates. And here they think that they're eating these foods that these diets advocate, and there's all kinds of diets where they ship you the food and this and that. Look, all they're concerned about is marketing, and all they want to do is to help you lose a pound of fat. So they can do that. It's very easy to do, frankly. but the foods that you're eating are devoid of any nutrients. So while you're losing fat, you're getting sicker internally. It's a vicious cycle. You got to believe me on these things. And these people are getting sicker and sicker and sicker. And, you know, they're being admired because they've lost fat. Oh, Sally, you look so good. You went from a size 6 to a size 2. Oh, my gosh. And then Sally ends up having high blood pressure. Sally ends up having, you know, kidney disease or a heart attack or dementia or what. But hey, she looks good in a size 2. And I know it sounds facetious, but it's the truth. I hope you can handle the truth. All right, because that's the only thing that's going to set you free. And that's my obligation to you, is to tell you the truth. Also, the gut. There's a link there. Your intestinal bacteria, they're a part of the immune system, and the research has discovered that those microbes that are in the gut, there's all kinds. They are instrumental. They have all kind of roles in countless areas of your health. And the beneficial bacteria also control the growth of disease-causing bacteria. And they also, those bacteria, when they get in there, they're eating all the nutrients that you're getting. So the more they eat of it, the less you're getting of it as well. This is of immense importance, because the pathogenic bacteria and the other less beneficial microbe, what they do is they wreak havoc with your health if they gain, especially if they gain the upper hand. Those gut microbiomes, gee whiz, they're involved in the chemical reactions in not only in your gut, but in your brain as well. And boy, they can wreak havoc. It's so very, very, very important that you're eating, you're controlling those gut microbiomes. And you know, the probiotics are what we advocate to normalize. Not only that, but it's going to help in reducing your blood pressure. Now, listen to me very carefully when I say this here, because there's been a lot of these ads on TV where you see the celebrities and they're advocating, you know, eat this different yogurt with the fruit and do this and do that, and you're going to have these gut microbiomes. You're going to have these probiotics in there. I'm here to tell you that's only a half truth. Look, if you pick up the label of your favorite yogurt, whatever it is, if it doesn't say on the label, if it doesn't say active bacteria, if it doesn't say it on the label, then put that thing down and go through the different products that you have there in the yogurts until you find one. Because if it doesn't say that they're active bacteria, then they're all dead, and they're not doing you any good whatsoever. And all you're doing is eating a glorified dessert. That's all you're doing. You're wasting your money. You're feeding the enemy, because it's just sugar you're eating. It's not helping you at all. And here, all along, you thought you were getting healthier and healthier, when in fact you're spending your hard-earned money and you're getting sicker and sicker and sicker. So look, if you're going the yogurt route, then you got to get active bacteria. Look for it on the label, and if it's not there, then don't eat it, because it's no good for you. Okay? Then also what you've got to do is get in the habit of eating fermented foods. And you know, you might try to do so every day. I recommend, you know, it's got to be a diet that's rich in whole, unprocessed foods, along with the cultured fermented foods. You know, you got to keep in mind that there's a great difference between traditionally fermented foods and commercially processed or pasteurized foods in which the probiotics have been added to them. They're not naturally occurring. They are added to them. It's like your milk, where it says vitamin D enriched, vitamin A enriched. You've got to understand that it's not in the milk. It's not in the beverage, and it's been artificially added. And what they've added is artificial as well. So you've got to be astute and be educated when you're starting to buy these things. So a general guideline is You want to eat about a half a cup or maybe 2 to 4 ounces of fermented vegetables or other cultured foods every day, like raw yogurt or kefir. You want to do that. Another good food is like sauerkraut, your cabbage. Those things are very good. And when you do those, when you start eating those foods, those cultured foods, they're very efficient also at detoxifying your body. So it's going to help to clean out some of that garbage in your bowels. It's going to help to get rid of some of those noxious bacteria that's in there. And you can do this every day, every day, every day. And as you do, you're going to start to feel better. You're going to start to look better, and you're gonna turn there in a direction where you're going to get healthier and healthier. And you also want to start to explore some other diet options there. In addition to the fermented foods, there's additional dietary strategies that you can use. The Mediterranean region, it's a very good diet, especially the Greek Mediterranean. If you're looking at, because there's like, I think 16 different nations or countries that surround the Mediterranean. So there are benefits to one or to the other, but the Mediterranean, by and large, it's known for its rich olives and the olive oil, the fresh veggies, the fruits, the seafood, and those types of foods are going to be really, really good for you to eat there. See, let me see, what else can I think of here? Um, you want to eat high fiber foods, the healthy fats I mentioned, the heart healthy foods, like the oils, the coconut oil, the olive oil, the avocado oil, let me see, avocado, not the peanut oil. Macadamia oil, those are all good. They're very good oils. Don't any longer cook with the vegetable oils, the corn oils, the safflower oils, the peanut oils, the canola oil. There is no such thing as a canola plant. Don't eat with the canola oils. None of that garbage. It's very, very bad. And if you want to season your foods, use that Mrs. Dash or whatever it is, or use some of your own concoctions there. Okay, that's what you want to try to do. Now, as we get off into it, away from the diet, you can get into some of these essential oils. There's a lot of people that are getting into that right now. And, just the calming effects that it has. You can make up a nice bath with Epsom salt and baking soda and add your favorite essential oil to the bath, a few drops of that. Lie back in there and soak in there, and check them out and see what's beneficial to you. There's a lot of different essential oils now. There's the bergamot. That's an oil that's used in cosmetics for scent. It helps to reduce blood pressure. There's the Sierra sage. That also helps to reduce it. There's the rose oil, the frankincense. Some of these, I'm sure you're familiar with. Rosemary, that's another one. Yin yang, that's another one. There's lemon balm. And of course, there's lavender. All of those types of oils, they kind of set the stage and they calm, individuals down. And you might get an aromatizer or for your home and use it in your bath and whatever, and change the environment in your home. But also you want to include exercise. You got to do this on a regular basis. Inactivity and blood pressure, they're closely related. You show me somebody who just sits around like a couch potato, and I'll show you somebody who invariably, if they don't, they're going to be. If they don't already have it, they're going to have it. That's high blood pressure, of course. And exercise is very, very important. People that have a 30 to 50% greater risk of high blood pressure are those that don't exercise. I mean, that's just the statistics there. So get out, even if it means going for a nice brisk walk in the evening or in the morning or whatever. Get out there and get active, because as you do so, as you become active in that's going to reduce your blood pressure. Make it a new habit that you develop, a new way of living, okay? And then also, you've got to get some drug-free methods to control your blood pressure. Okay, that's what you might consider doing, especially getting rid of the smoking. You want to quit the smoking. You want to address your potassium and your sodium. Look at your diet. Start to increase the potassium-rich foods and start to get rid of the salty things, those processed foods and whatnot. You might even consider, practicing intermittent fasting. I've done a video or a webinar on that you can go to our YouTube channel and look that up. It's there for you. Just doing things like that. And then also, you got to, of course, address your stress. I mean, we live in a stress-laden society today. And, it's no surprise the connection between stress and high blood pressure, it's well documented. Nobody has to tell you that. You don't need to see research to know that. But you just got to realize that, hey, you adapt so well that you don't even realize that you're in a stressful situation. And that's a day in and day out, day in and day out. It becomes a normal way of living. And then you look at your blood pressure and you see that it's up. So you've got to reduce or control some of the stresses in your life. Those emotions like fear. Oh, God forbid. We have so much fear right now going on, and anger and sadness and confusion. Oh, gee whiz. You just have to take control of the situation, take a deep breath, and go through it one step at a time to learn to cope with it. And understand that stress is a normalcy. Everybody is under stress, but it's how we handle it, how we address it. The good news is that there's stress, there's strategies out there, that you can take up meditation. You can go for your walks at the end of the day and start to vent, start to talk to God, or you can meditate in the Bible, or you can take up yoga. You can do breathing exercises. There's all kinds of things that you can do that will help you to eliminate and reduce the effects of stress on you. And those are things you want to get into, because that's the world that we live in. And I don't think it's going to get any calmer. As stressful as it is today, it's probably going to be a little more stressful tomorrow, I'm sure, especially with what's going on in our day and age. Right? Right. So look, I know I've given you a lot of information, and you may have locked into one thing as I moved on to another. So I invite you to ask and to ask away. If you like, you can email us with your questions at office@pro-activewellness.com. Again, that's office@pro-activewellness.com. Email us those questions, or you can call us, or you can even request a video consult. Well, I'm doing that right now as a moral obligation to not only our patients, but people around us that have so many questions today. You're welcome to go ahead and sign up for a video consult. We'll be more than happy to do that and address any questions that you have. We'll do that for you. So just give our office a call, email us, whatever, and we are here at your service. Look, I want to thank you once again so very much for allowing me to share this information with you. Thank you very much. And until the next time we're together, or the next session, and as always, God bless.